Admitting your baby to the nursery is stressful for both parents and the baby. This video offers insight into reading non-verbal cues from your baby, helping you interact and provide effective support during your baby's vulnerable moments. Our focus today is on developmental care, a philosophy of care that helps your baby cope with the stresses in their environment.
It centers on simulating the ambience of the womb, which may comprise dimming of lights, reducing noise, and minimal touching. The good news is, as your baby gets better, you will be able to interact more and provide encouragement through auditory and sensory stimulation. It is important to observe and understand your baby's responses to certain stimuli, as excessive stimuli may drain their energy needed for essential functions like breathing, digesting food, and growing.
Parents will learn to respect sleep-wake states, cycles, and transitions, position and handle the baby correctly, provide appropriate sensory stimulation, maternal smell, mouth care, comforting touch, etc. Let's get into how we can identify if your baby is ready to interact with you.
Premature babies often spend most of their time sleeping, usually requiring an average of 17 to 20 hours of sleep a day. Protecting and promoting sleep in our premature babies is important for brain development. In the nursery, you may notice certain timings that we provide care for your baby, after which we allow your baby to have uninterrupted sleep. We also adopt cue-based care when your baby demonstrates discomfort from their soiled diapers.
It is important then for nurses and parents to recognize the various arousal states to best accommodate to the infant's needs. Now, let's explore the 6 states of arousal and when it is best to interact with your baby.
Deep sleep, your baby will be still, barely responding to external noise and stimuli, and can be difficult to arouse. Light sleep, your baby is still, but can be easily disturbed by noise or touch. Drowsy, your baby starts opening their eyes, moving limbs, stretching, and stirring. Quiet alert, your baby will be laying calmly. They may watch you intensely. This is the best time to interact with them and may only occur briefly. Active alert, your baby will be moving their limbs more actively and squirming about. Crying, while unpleasant, crying is your baby's main method of communication and not always a sign of distress. This may mean they need their diapers changed, are hungry, feeling tired, or just want to be picked up. In the first 3 states of arousal, your baby is not yet demonstrating readiness to interact. We try not to wake your baby up unless emergent interventions are needed to allow uninterrupted sleep. These are the signs when your baby is feeling overstimulated and stressed. The stop sign. Your little one is saying they need a break and requires comfort instead. Yawning or hiccups can also be a sign of overstimulation. Looking away from you or having their fingers splayed open. This is how your baby sometimes communicates stress and tries to reorganize themselves by looking away. Flailing, frowning or grimacing, having a panicked look or suddenly waking up from sleep, having physiological changes like increased heart rate or breathing. These signs of stress may indicate your baby is not ready for active interaction, but this does not mean you cannot comfort or hold your baby. As preterm babies are unable to self-regulate, parents can adopt these strategies. Doing skin to skin. This is a wonderful way for mummies and daddies to bond with your baby while providing comfort and familiarizing them with soothing sensory stimulation. Letting your baby grasp your finger. Giving gentle and firm touches to your baby. Ensuring your baby is snugly swaddled. Changing positions. Remember, these actions help your baby deal with stress and regain control to soothe themselves. Look out for these positive signs for interaction. Your baby should be calm and relaxed. They may be smiling, alert, or in a comfortable position. Be patient with your baby as they learn to regulate themselves and find their preferred sleep habits. It will get better with time as they grow and stabilize.
Learning to read your baby's cues will come naturally with a little practice. As always, do not hesitate to ask our nurses to assist you if you have any questions about settling or interacting with your baby.